Thank you to first-time listeners. This is YouTube Medical University. Suddenly, do you all know about prostate cancer screening? It's called prostate-specific antigen. Simply put, it's a characteristic protein in the prostate that is detected in blood tests to find prostate cancer early. This is widely done as a health check in Japan. Actually, the American Urological Association and the American Preventive Medicine Specialist Committee have said that we should stop doing this prostate cancer screening indiscriminately. Now, why is that? Why is it widely done in Japan? There was a deep question hidden here. This time it may be a bit of a revelation, but why is this prostate cancer screening divided in the medical world? What are the merits and demerits? I think it's strange that only medical professionals know. I hope each and every one of you. I want you to think about the merits and demerits and decide whether or not to take this prostate cancer screening. A man in his 70s who came to consult me had taken this prostate cancer screening without much thought because it was recommended to him, and lo and behold, early stage prostate cancer was detected. However, considering his age and the progression of the disease, he was told that he would not be treated for now and would be monitored. But the patient who came to consult was apparently very anxious. "Doctor, I've been told I have cancer. Is it really okay to do nothing? Is there no chance it could spread throughout my body?" He asked me questions like that. In fact, in most cases of prostate cancer, if it's up to stage 3, the 5-year survival rate is 100%. In cases where it has metastasized to the bones or lungs, known as distant metastases, it becomes stage 4 and the 5-year survival rate suddenly drops to 60%. Of course, there are exceptions of cancers that progress quickly, but most prostate cancers are characterized by a good prognosis. So, like the patient I just mentioned, it's not uncommon to be diagnosed with cancer and become anxious, but especially now there's nothing to do and it turns into a situation where it's just watchful waiting. This is called overdiagnosis in professional terms. Of course, there are merits to being able to diagnose early and follow up, but at that point there is no data to suggest that treatment reduces mortality and so on. So who should get this prostate cancer screening? And what are the merits and demerits of prostate cancer screening? I'll explain it in a way that's easy to understand. First of all, what does the prostate do? It's located under the bladder and is closely attached to the urinary tract. This prostate produces what's called prostate fluid, which protects the semen during ejaculation. It also plays a role in regulating the passage of semen during ejaculation, preventing it from going back into the urinary tract by tightening or widening the passage. The prostate, which has such a role, actually begins to increase gradually from around the age of 50 in men, and it is said that 1 in 2 people will have prostate cancer by the time they reach 80. That's a lot. In terms of the incidence of cancer in men, this prostate cancer is number 1. I think you can see how common it is. So, about whether or not to get this prostate cancer screening, the first thing I would recommend is to get it when symptoms appear. Symptoms will appear as prostate cancer progresses. There are mainly 3 types of symptoms. The first one is urinary obstruction. You feel like you can't urinate. It doesn't come out a little at a time. The force of the urine is decreasing. And the second is frequent urination. It's a symptom like, "I've been going to the bathroom more often lately." And the third is a sense of residual urine. You can't feel like you've urinated or it's urinary incontinence. Even if you don't feel like urinating, urine leaks out. If you have these symptoms, it may be the initial symptoms of prostate cancer. It's simple to explain why these symptoms occur. For example, if you have difficulty urinating or lose force, it's because if cancer occurs in this prostate, the urethra gradually narrows and is compressed, making it difficult for urine to pass through and the force decreases. Or if cancer occurs in the part near the bladder, the prostate cancer compresses the bladder, which stimulates the bladder. And we misunderstand that the bladder is full. It leads to frequent urination. As a point of caution, if cancer occurs on the lower side of the prostate, it does not compress the bladder. So there may be no symptoms of frequent urination. And the third is a sense of residual urine. You can't feel like you've urinated, or it's urinary incontinence. Even if you don't feel like urinating, urine leaks out. Why do these symptoms occur? As I mentioned earlier, using ejaculation as an example, the prostate has a role in contracting and expanding this path. If cancer occurs, and the power to regulate this weakens, when you want to urinate, the prostate contracts and urine can't come out until the end. Or conversely, when you don't think you want to urinate, the cancer can't regulate it, so the urethra expands and urine leaks out. Such symptoms may occur. However, there is one point of caution. Many of the symptoms I just mentioned also appear in a disease called prostate hypertrophy, where the prostate becomes enlarged. Therefore, if you have the symptoms I just mentioned, it could be either prostate hypertrophy or prostate cancer. Again, it's not clear whether it's another disease. Rather, the incidence rate of prostate hypertrophy, where the prostate becomes larger, is much higher than that of prostate cancer. The probability of occurrence is high, so it can be said that the possibility of the former is higher. If it's prostate cancer, it's unpleasant, so if you have such symptoms, it's better to get a prostate cancer diagnosis. This is the same view in both America and Japan. Then, who do you think is prone to prostate cancer? Such people also need to pay attention to the symptoms of the prostate. One interesting study is from Harvard University, which gathered men in their 40s and found that those who ejaculate more than 21 times a month actually have a lower risk of prostate cancer. If you don't engage in activities more than 5 times a week, the risk doesn't decrease, and it's quite tough to engage in activities 5 times a week when you reach your 40s, but you should do it as much as possible. The risk of prostate cancer may not decrease. Other risks include having a family member with prostate cancer, which doubles the risk. If multiple people, such as your brothers or father, have prostate cancer, the risk is said to increase more than 4-fold. Other factors include obesity and excessive oil intake. It's called westernization of diet, but the incidence of prostate cancer in Japanese people is gradually increasing. One of the factors is the westernization of diet. It's about eating meat. The saturated fatty acids contained in meat are noted to increase male hormones and worsen prostate cancer, increasing the risk of onset. There are other factors as well. It is said that benign prostatic hyperplasia itself can also be a risk. But there is no solid data that people with high income and high education and people who are not sociable and prefer solitude have a higher risk of benign prostatic hyperplasia. However, there is some data to that effect. If you are at risk, as I just mentioned, or if you have symptoms of prostate cancer that we talked about earlier, please consider getting a prostate cancer diagnosis. Then, whether it is good or bad for people without symptoms to get this prostate cancer diagnosis, I will talk from the conclusion. It is up to your consideration. Decide after discussing with your primary care physician, considering your age, risk, and the merits and demerits. In that sense, it is important to meet a primary care physician who can clearly explain the merits and demerits and who can consult with you. Even in the medical world, as I mentioned earlier, opinions are divided. In a statement by the American Preventive Medicine Specialist Committee, a highly authoritative preventive medicine organization, it is generally not recommended to measure prostate-specific antigen to detect prostate cancer in asymptomatic people. In Japan, the Ministry of Health, Labor and Welfare does not include prostate cancer screening in the cancer screenings conducted by local governments, similar to the stance in America. For example, breast cancer screening, cervical cancer screening, colon cancer screening, etc. are done by the country because there are merits, everyone does it, and if you do it, we will subsidize the funds. It has become like that. However, regarding prostate cancer, whether there are merits or not is still not well understood. So if you want to do it, please do it at your own expense. It has become an optional cancer screening. There are people who think that it might be better not to have cancer screening or that there might be such a thing. That's right, I think it's better to detect cancer early, but I understand that there are many unexpected demerits. So what are the demerits? As I mentioned earlier, even in the case of prostate cancer, the 5-year survival rate is 100% up to stage 3. Therefore, it's good that the prostate-specific antigen was high in the prostate cancer diagnosis, but in the end, after various detailed examinations, it didn't seem to be that bad or due to age. After listening to the patient's treatment preferences, in the end, there are cases where we decide to just keep an eye on it without doing anything. When it ends up like that, there are costs for detailed examinations, physical burdens, and above all, the mental burden is very large. I think those who are diagnosed with cancer often feel unsettled. How about you? Isn't there a big difference in happiness between living knowing that you have cancer in your body and living without knowing it? In a study at Harvard University in America, there is data showing that the number of suicides and heart attacks is more than double among those who have been diagnosed with prostate cancer compared to those who have not. I think it's clear how shocking it is to be diagnosed, and there's another downside. There is a test called a needle biopsy to determine whether or not it's cancer. In this examination, an echo is inserted from the doctor, and while confirming the position of the prostate, a needle is thrust from the skin of this space between the anus and the scrotum, and the actual prostate tissue is taken out and examined under a microscope to see if there are cancer cells. An echo is inserted from the doctor, and then a needle is thrust into this skin. Just thinking about it sounds painful. In reality, the examination itself is almost painless and usually ends in about 15 minutes, but it's scary to actually have it done. In many cases, you'll be scheduled for an overnight or 2-day examination. And there's another downside to the examination where bacteria can get in and cause an infection, resulting in a fever, or the urinary tract can get hurt and blood can mix into the urine, a condition called hematuria, and then you might not be able to urinate. There's a possibility that such complications can occur. By examining the prostate-specific antigen, you might discover prostate cancer that is okay to leave untreated. This is called overdiagnosis, and it's a downside that you might overdiagnose, or there are complications from the examination itself. There are such downsides. No matter how much you say it's bad, there might be people who think it's better to find cancer that doesn't need intervention and just regularly get checked by a doctor and get treated when necessary, but I think that's the way it is. The merits and demerits I just mentioned, and depending on your age and risk and how you want to live in terms of your health, it's important to discuss this with your primary care doctor and make a decision. The prostate-specific antigen test greatly impacts the recipient's life. Currently, it's unclear if asymptomatic testing is beneficial. If not recommended by a doctor, it's best to avoid the test. Those who say it's hard to live being diagnosed with cancer unnecessarily may not need to take it. On the other hand, some may want to take the test because there is a risk in terms of family history. Some people feel uneasy about not taking a test when it's available, so they'd rather take it. It's good to have various options. Like any test, there are merits and demerits, so it's important to think about it based on your own thoughts and consult with a doctor who can take your concerns into account. After all, what is health screening for? Is it to detect abnormal values? No, it's for maintaining health. Mental health is also important, so please think about what health means to you. Now let's simply explain how to respond to the actual cancer diagnosis, the prostate-specific antigen test. Simply put, if the value is less than 4, it is considered normal, and in most cases, you can assume that there is no prostate cancer. Of course, there are exceptions, so caution is needed, but basically, less than 4 is considered normal. And if the value is 10 or more, it basically means that you have been caught in a prostate cancer screening. So in most cases, you will go to the urology department for additional tests. As for what specific tests will be conducted, it's a prostate examination by a doctor. Some of you might be a little squeamish, but the part of the prostate that has cancer usually hardens. So, we insert a finger from the anus and directly palpate the prostate. We check whether it has hardened or enlarged. Another test is an abdominal ultrasound. With an ultrasound, we can see the size and shape of the prostate, and then we may perform a needle biopsy that I mentioned earlier, or we may perform a magnetic resonance imaging examination. So what should people with values between 4 and 10 do? Basically, people with values between 4 and 10 should continue to be tested. We don't tend to ignore the value of this prostate-specific antigen, but we may take it again after a while. Or we may measure something called free prostate-specific antigen, which is more sensitive than prostate-specific antigen. Or we may follow up considering your age risk. One thing that can cause the prostate-specific antigen test value to be erroneously low is if you're undergoing treatment for androgenetic alopecia. This is for those undergoing treatment for benign prostatic hyperplasia. Those undergoing treatment for androgenetic alopecia or benign prostatic hyperplasia with medication affecting male hormones may experience low prostate-specific antigen values. Is dangerous if the level is low, even though there is really cancer. So those who are taking such medication need to consult with their primary care doctor about whether to stop the medication in advance or not to do the test itself, and so on. And finally, in the case of prostate cancer, one of the major treatments is surgery. And the surgery for prostate cancer is actually called a Da Vinci surgery. Do you all know what Da Vinci surgery is? It's a robotic surgery. What happens is that the patient is in the operating room, but all the equipment in there is mechanical. The machine is in there, and the doctor operates the machine remotely while watching the screen and moving the robot. That's what the surgery is like. The good thing about this is that the surgical wounds are smaller and there is less bleeding. Even the best doctors can have a slight tremor in their hands, or there are things that can't be seen with the naked eye, so they have to make the wound larger to see it. Da Vinci surgery has solved many difficulties in prostate cancer treatment, improving results significantly. Another treatment option is hormone therapy. What does hormone therapy involve? Prostate cancer is said to be at risk when this male hormone rises. Therefore, there is a hormone therapy to lower this male hormone, which is used in the treatment of prostate cancer. On top of that, even after undergoing prostate cancer surgery, there was a recurrence. But it was widely reported on TV that this hormone therapy was performed. I think many of the people watching this video are health conscious, and there are many people who are actually suffering from prostate hypertrophy or prostate cancer. On YouTube, medical and non-medical professionals share medical information, mostly beneficial, but sometimes misleading. To prevent using incorrect information, I will explain it clearly from a doctor's perspective, including data and statistical analysis. I think it's important to have a credible channel, so if you could subscribe to the channel so you don't miss new videos, it would really be encouraging. And in the comments section, I actually think this about this examination. I had these symptoms. I was actually treated like this. If you have such information, please let me know. And whether it's a good button or a bad button for this video, if you could rate it, it would be a motivation for the next one. So let's meet again in the next video.